Hi, welcome back. Now we are going to discuss about the continuation of previous session. In last session, we did discuss about the function in the hip complex, especially the biomechanical function. There we had two classification. One is the motion of femur on a fixed pelvis, which is like we are walking, we are moving forward, sideways movement, dancing, etc. The second one was the motion of pelvis on a fixed femur. That is, we are standing like this, the anterior tilt, the posterior tilt. There we saw the anterior pelvic tilt, the posterior pelvic tilt, lateral pelvic tilt. And if anyone is watching this video for the first time, I would request you to kindly visit and watch the previous video, because that would help you to understand this class much more easy. The link is here given below. So let us proceed with this class. Here we are going to discuss about the pelvic tilt, which we had discussed earlier. We are going to take it forward and discuss lateral pelvic shift. The topic is the lateral pelvic shift. Lateral pelvic shift. See, here it is lateral is common, pelvis is common, shift, and there it is tilt. So we might get confused, but let us get it to our head and let us make it clear what is shift, what is tilt. Before that, what was lateral pelvic tilt? Can anyone recollect it? Just recollect what was lateral pelvic tilt. Come on, lateral pelvic tilt is a mechanism in which, especially happening in the unilateral stance, the pelvis moves upward, your pelvis lift upward, or your iliac crest moves upward or downward. There is up hiking or pelvic hike and pelvic drop. Both mechanism is possible. That is lateral pelvic tilt. Or in simple words, your iliac crest moves upward, iliac crest moves downward. In which plane? That is in the frontal plane and in the AP axis, because that is where this abduction, adduction, etc. occur. So that is in the frontal plane and in AP axis. Now, can I ask you something? Can you demonstrate the lateral pelvic tilt in bilateral stance? Can we do lateral pelvic tilt in bilateral stance? Is it possible for us to do lateral pelvic tilt in bilateral stance? For this, I need your cooperation. All of you, please stand with me and let us do this by demonstrating ourselves, by practicing it. Not feel shy. Let us do it together and we will learn it together. Okay, let us stand. This is the bilateral stance. And our task is, in this bilateral stance, somebody assigned you some task. You need to demonstrate what is lateral pelvic tilt in this bilateral stance. In unilateral, it is easy to demonstrate. So in bilateral, how to demonstrate? For that, you need to stand straight. Okay, I would request you to place your hands on your iliac crest. Please, all of you, let us place our hands on the iliac crest. Can we examine ourselves? Am I having any lateral pelvic tilt or anterior tilt? No, I'm fine. This is in straight line. Now we want to demonstrate lateral pelvic tilt in bilateral stance. For that, slightly move your one leg. Let us take for this example, left leg as fixed one, the fulcrum, and right as moving. Let us move the right hip for some flexion, a slight flexion of the right hip, combined with that slight flexion at the knee joint. So you see this, I have transferred my weight from this, I have freed my right leg and transferred my whole weight to the left leg. Or I have moved my right leg slightly forward and I have slightly flexed it. So only light weight bearing, weight is being beared by that. Not completely, not full. But the majority of the weight is by this hip itself. So now you imagine, now let us get back. Okay, that is the movement that we are going to demonstrate. Okay, so place your hands over here. Now place your hip over the front. Is there any change? I don't think so. Now slightly flex your knee, slightly flex your knee. What is happening? You can feel that your pelvis drops slightly. You can see that, in my view, see in my body, this is a bit downwards than the other one. Here, if you are taking back, you can understand the difference. When I am taking back, it is coming up, the pelvis is coming up. When I'm taking back, the pelvis is coming up. So this is an example of bilateral lateral pelvic tilt. But can you do the pelvic hike here? In unilateral, we can have hiking and down hike, or pelvic hike and pelvic drop. Can you do hike over here? It is tough. Then the weight shift will change. Here it is only possible to do the pelvic drop. So the pelvic drop is occurring only here. It is tough to do the hike because already knee is flexed. You cannot demonstrate the hike over there. So in bilateral stance also we can demonstrate the lateral pelvic tilt. That is what I want to give you. The bilateral stance also we can demonstrate, and the position adopted is stand in the bilateral stance, place your hands over your hip, the iliac crest, this is our reference point, and move your hands, move your leg for slight flexion and knee for slight flexion, hip slight flexion and knee slight flexion, and there we get a lateral pelvic tilt. The pelvic is going for drop. Not for hiking, the pelvis is going for drop. Now, forget that. Our discussion was lateral pelvic shift. How to demonstrate lateral pelvic shift? Here, to demonstrate lateral pelvic tilt, shift, I want to give you the same scenario. We are standing in the bilateral stance. The movement is taking place in the frontal plane and in the epi-axis. Now, the same movement, let us stand in the bilateral stance. Okay, now, what I want to do is, I want all of you to hold your hands like this, making a cup or a concave cavity. As biomechanical students, movement specialists, let us call it concave shaped. And you place it on your hip, exactly at the femoral head, structure palpate, in the great trochanter, or in the hip joint axis, hip joint itself. You can place it in the cavity in such a way that the trochanter comes inside your hand. Okay, and now we want to demonstrate the same movement. I am moving my hip forward, hip for slight flexion, okay, and knee for slight flexion, hip and knee for slight flexion. And now I am going to shift my weight entirely on this limb. This is what we are going to do. We are going for that same position, and at the same time we are moving the entire weight to our fulcrum. You should demonstrate, you should do that with me, okay? Let us do that. We stand like this, we hold our hand with cup shape and we place it on the greater trochanter on the hip femur, hip joint axis on the hip joint, and now we go for the hip flexion with slight knee flexion. That is okay. Nothing is happening in our hand. We don't feel much change in our hand. Okay. Now you shift your entire weight to the left leg. What is happening? You feel that your femur, the pelvis is coming to that side. You can feel that this is hitting here like this. That you can feel. You can, for example, my hand is like here. Now just observe my left hand. When I'm shifting my weight, see, my left hand is moving backwards or sidewards, laterally. Exactly speaking, it is moving laterally. This is lateral shift of the pelvis. From this neutral position, my pelvis shift laterally. So this will be the position. A person with lateral pelvic tilt shift, if it is exaggerated, he might show you like this. He may walk like this. That is, the pelvis is shifted laterally like this. Okay, so this will be the adopted position. If it is, it will have combined pelvic tilt also. Need not worry about that. So here the pelvis is shifted to the lateral side. Now understand, pelvic shift is a mechanism in which the pelvis get shifted laterally. It not get tilted. Tilted means the anterior superior iliac spine, the crest comes upward. Here what happens is, this just moves like this. This just moves like this. It gets shifted. Okay. Here the other plane, this moves upward. For example, in the other criterion, the lateral pelvic tilt, this moves upward like this. This moves upward like this. It moves downwards, downward hiking. Here what is happening? It moves up outward. It moves outward. That is the lateral pelvic. The pelvic itself, the pelvic cavity itself gets displaced. The pelvis itself gets displaced. Let us demonstrate it once again. It is very nice to palpate and observe. You place your hand in cup shape over your pelvic cavity. You move for hip flexion. You move for knee flexion. You shift your weight to this, and inside this concave cavity, you feel that the head of the femur is pushing. Yeah, head of the femur is pushing. So that is the lateral shift of the pelvis. So that is clear. I hope it is clear. The lateral shift is the movement of the pelvis to the lateral side, the displacement of the pelvis in the lateral side. And this movement also occur in which plane? The pelvis tilt is occurring in the which plane? This plane is known as the frontal plane. The same plane this movement is happening. So this movement takes place in the frontal plane. If it is a frontal plane movement, the axis should be AP axis. So it is a frontal plane movement and it is an AP axis movement. It is a frontal plane and AP axis movement. Clear? Now, for going in depth, now I want you to move to that lateral shifted position. Let us move for the lateral shifted position, or place the hand leg forward and hip flexed, this position. Now you go for lateral shift. Lateral shift. This is the lateral shift. This is the lateral shift. Just observe what is happening to your weight bearing hip. The weight bearing hip goes for adduction. Even though your pelvis is moving outward, this hip over here is going for the leg, the extremity, the distal end is going for adduction. The distal end will be pushed inside the body, that is adduction. So during lateral pelvic shift, the weight bearing joint, the weight bearing leg or weight bearing limb moves for adduction, whereas the other limb will move for the abduction, because this is the same. We are doing it in the abduction itself. The other limb will move for abduction. So in weight bearing and bilateral stance, if we attempt to do the lateral pelvic shift, what happens is that the shifted weight, or if the weight is shifted on the right leg, that right leg will move for adduction, or the limb in which the weight is beared, the weight bearing limb or weight bearing leg, weight bearing hip moves for adduction. So, and the other moves for abduction. So your criterion or a scenario in front of you, a patient is standing in the lateral shift on his right leg. Okay, that means the weight bearing is on the right leg like this. What is happening? Which is identify the motion in both the limbs. In right leg it is adduction, in left it is abduction. That is all about lateral pelvic shift. I hope it is clear for you all. And we have a last movement to study. We have a last movement to study, that is forward and backward rotation. That is forward and backward rotation. Backward rotation. Okay, here this is a rotatory movement. The word itself demonstrates or illustrate that it is a rotatory movement. Here we are going for rotatory movement, and the criterion of the scenario over here is unilateral stance. Okay, and in unilateral, let us assume that position. Nobody should sit down. All of you, please let us demonstrate it ourselves, so that it's we get it in your mind rather than reading from the textbook. The theory, more than theory, the practical stays in your mind. So focus on this. Here we are going to do it in this manner. I am assuming this is the bilateral stance. I am moving forward. Okay, I am moving forward. I want to move to the camera. I want to move to the front, or catch the table, or get that pen over there. So for that, what I am doing is, you just imagine this is the weight bearing limb. Left is the weight bearing limb. Now I have to move forward like this. I have to move forward. Now here I want your hands to be placed here in front of the hip joint, slightly near the thigh, See, now in this bilateral stance, this is in the same level. Okay, now I am going for what movement? I'm going for the flexion. I'm going for the forward movement, or I'm going for a bilateral stance movement, unilateral stance. I'm not putting my leg down. Okay, it is tough for me to hold also, so I'm just keeping it down. Imagine that the leg is up. Yeah, I'm going for the flexion. So during this procedure of the flexion, what happens is, along with you, your pelvis gets shifted like this. The pelvis rotates. Only because of that pelvis rotation, you can easily move your limb. If the pelvis is fixed here, you might feel it tough to move. So what actually happens is, you just imagine this hand. What happens is, just look at my right hand. When I'm going forward, the right hand is coming forward. That is, the pelvis is rotating anteriorly. You cannot demonstrate this much movement. There is only negligible movement. The pelvis gets rotated like this, so my leg also moves forward. If the pelvis gets rotated anteriorly, you can feel it. All of you just demonstrate yourself and try yourself and do it like this. When you are going for the flexion, you can feel that your pelvis, right pelvis moves anteriorly. When your right pelvis rotates anteriorly, that is known as forward rotation or anterior rotation. So forward rotation is also known as anterior rotation. Now your right leg is in front. Okay. Now you want to take that step backwards. There is some water on the floor. You want to take the step backward. You are moving it back for the extension. See, my hand which was in anteriorly or forward goes forward, backwards. That rotation is known as the backward rotation. So this is backward rotation, this is anterior rotation. A slight rotatory movement. Anterior rotation and lateral rotation. Sorry, posterior rotation, backward rotation. So this is the rotatory movements of the pelvis. One is anterior rotation or forward rotation, where the pelvis moves anteriorly, rotates anteriorly. The second is posterior rotation, the pelvis moves posteriorly. Clear? That's all about the rotatory movement. Once again, anterior rotation or forward rotation, pelvis rotates anteriorly. Posterior rotation, pelvis moves. That same limb we are taking it backwards because that step was not good, so I'll take it back. Okay, and that is the posterior rotation. Clear? That is in unilateral stance. Now, what about the bilateral stance? Can you demonstrate the same in bilateral stance? Yes, of course. Before that, let us see which plane this movement happens. So this is exactly like medial rotation, lateral rotation. So that plane would be this plane. This plane is known as the transverse plane. So the axis would be vertical. So this movement takes place in the vertical axis, transverse plane and the vertical axis. So the movement of anterior and posterior rotation is taking place in the transverse plane and vertical axis. Okay, now back to the bilateral stance. I want to demonstrate this. For example, in bilateral stance, both limbs are weight bearing. I want to move forward. Okay, I want to take a step forward. Let us take that step forward. When we are taking that next step forward, this pelvis is actually rotating with us. The pelvis is actually rotating with us. And I have assumed this bilateral stance itself because both limbs are in the down itself. Here, we say that the right leg had gone for anterior rotation. But what about the left leg? This has gone for posterior rotation. Let us practice it once again. Place your hand in forward anterior itself. Now move your right leg anteriorly. See, your right hand came forward. And what happened to your left leg, left hand? This had moved backwards. This has moved backward. This is in bilateral stance. Both limbs are weight bearing. Here we have to take a reference point. In this bilateral stance, the right leg moves forward, or right leg goes for forward rotation, left leg goes for backward rotation. So if it is opposite, if left leg is going for forward rotation, right will go for backward rotation. But in unilateral stance, need not worry about the left leg or one single leg, which is the weight bearing. You have to focus on the other leg. Here anterior rotation is this one, right leg moves anteriorly, the same right leg moves posteriorly, that is the posterior rotation. But in here, in bilateral stance, both legs are in down, you go for forward motion, the right leg, the leg that is moving anteriorly, that leg goes for anterior rotation, the opposite legs go posterior rotation. Is that okay? That's all about the motion of pelvis on a fixed femur. So if we summarize the motion of pelvis on a fixed femur, we get how many motions? 4 different types of motion, and this is to be remembered throughout your professional career. First one is anterior and posterior tilt. Anterior and posterior tilt. Now, lateral pelvic tilt. Third one, lateral pelvic shift. Lateral pelvic shift. Fourth one, anterior and posterior rotation, or forward and backward rotation. This occurs in the sagittal plane. This occurs in the frontal plane. This also occurs in the frontal plane, and this occurs in the transverse plane. Transverse plane. If it is transverse plane, it is vertical axis. And if it is frontal plane, it is AP axis. It is AP axis. This is coronal axis or x-axis. That's a 4 type of motion that the pelvis has on femur. I hope it is clear for you. If you have any doubt, refer to the last video on the anterior pelvic tilt, posterior pelvic tilt. With that, we wind up the motion of pelvis on the fixed femur. Now in the next video, we will be discussing something more important, that is limbo-pelvic rhythm. How the lumbar region and pelvis moves together like a chain, like a kinetic chain. How our body moves as a kinetic chain, we are going to see in the next video. Till then, stay tuned, and should I remind, if you find the class interesting, please hit the like button, and do feel to comment and ask any doubts if you have. I'll be there with you. Till then, thank you.